August first week is the breastfeeding week. As part of creation of awareness on breastfeeding, let's talk about nutritional advantages of breast milk and nutritional disadvantages of cow's milk. Mother's own milk is the best for any species for its babies. Humans are no exception. So, breast milk is best suited for human babies also. And bovine milk is obviously best suited for the calves. Various international organizations have suggested exclusive breastfeeding should be done for the first 6 months and continued for 2 years and beyond if possible. It is nutritionally dangerous to continue exclusive breastfeeding beyond 6 months of age because there are nutritional inadequacies beyond that age. And if you are deciding to continue breastfeeding beyond 1 year of age, we must make sure that the baby is not clinging on to the breast and avoiding other food items. Extensive evidence on breast milk shows that it contains a variety of bioactive agents that are especially important for various organ systems of the body, especially the immune system and the brain. American Academy of Pediatrics and CDC recommends no bovine milk should be given below 12 months of age. And thus, breast milk is widely recognized as the gold standard in infant nutrition. The key benefits of breast milk include, for example, prevention of entry of pathogens from intestine into our system, enhancement of our immune development, decreased chance of allergic diseases, useful gut microbiota, and fewer incidences of diarrhea, acute respiratory infection, etc. Let us first consider the composition of breast milk. The macronutrient composition of breast milk is about 3.5% fat, 1% protein, and about 7% carbohydrate, especially as lactose. The fat and lactose contribute to, say, about 50% and 40% respectively of the total energy of the milk. Fat is extremely important in development of brain because the brain basically is composed mostly of fat. Now, the composition of breast milk may vary in the same individual and from individual to individual. Same individual, for example, immediately after birth, it is colostrum, which is a thick yellowish fluid. Then as the baby grows, it becomes a mature milk. And in mature milk itself, when you start feeding, it is more watery, and towards the end of feeding, it is more thick. So, in the same individual itself, there is variation depending on the occasion. And the second thing is in the same individual, there can be changes. For example, suppose mother is taking some medicines like lithium, it comes into your milk. Some diseases which can actually spread through breast milk, maternal diet, etc. can influence the breast milk production and its composition. And the amount of breast milk is best when the mother sleeps adequately and drinks adequate amount of fluids. Let us now highlight the major differences between breast milk and cow's milk. This will help us to understand why breast milk is best and what characteristics we must look for in case we have to go for alternate milk for any reason. The growth rate of calves is very fast. In 6 months, the human baby doubles its birth weight, but a calf doubles its birth weight in 6 weeks. So that much of exponential growth is there in cow. So naturally, the cow's milk contains more protein, about 3.5 times the amount of protein that is contained in breast milk. So this high protein content, its metabolites will have to be excreted through the kidneys. So the infant kidney will have to work extra to excrete these metabolites. For a full-term baby, this is nothing. The kidney will handle the load. But suppose the baby is sick or very preterm, then it becomes a problem. In addition to the quantity of the protein, quality of protein also differs. The protein in milk we can consider as two forms, whey form and casein form. Whey means it's a thinner protein, casein is a thicker protein. So when it goes into the stomach and mixes with acid, thin flocculents will form in case of whey protein. Thick, difficult to digest flocculant will form in case of cow's milk. In addition, the whey protein of human milk contains all the essential amino acids that are necessary for the human baby's growth. Not that cow's milk doesn't contain amino acid, it also contains amino acid in sufficient quantity, but the composition is such that it is best suited for the calf's growth. So whatever essential amino acid is there for the calf, that is not the essential amino acid that is required for humans. So that is the difference. The breast milk has got a low probability of causing any allergic reaction. This is due to the difference in protein components of these two milks. Some proteins in cow's milk will be identified as foreign or foreign protein by the human baby and will react in an allergic fashion. You should not go with the idea that once you exclusively breastfeed, there will be no allergic reaction or allergic diseases. No. Actually, allergy is determined by a lot more of factors in addition to milk. So you can still have allergy, but the point is in a breast milk baby, the chance of allergy is much less as compared to a baby on cow's milk. The whey protein of breast milk contains alpha-lactalbumin, whereas the whey protein of cow's milk contains beta-lactoglobulin. So that is a different type of protein. Since it is different from what is present in human milk, the baby may identify it as foreign and may predispose to milk protein allergies. Even the small amount of whey protein that is present in cow's milk is poorly absorbed as compared to whey protein of human milk. And the composition of whey to casein in human milk is 82 to 18, or we can say 80 to 20. But that of cow's milk is just the reverse, which means a lot more of casein. And casein forms very thick curd, which is difficult to digest. Now let's examine the lipid profile. Lipids provide 50% of energy available from milk. That is same in case of cow's milk also. But the fatty acids present in human milk is different from the fatty acid that is present in cow's milk. Especially human milk has got a greater concentration of polyunsaturated fatty acid and essential fatty acids. What is essential fatty acid in human may not be the essential fatty acid in cows, and that is why the difference. For instance, the recommended level of essential fatty acid, linoleic acid, must contribute to 3% of energy in babies. So breast milk linoleic acid 4% as compared to 1.8% in case of cow's milk. Another important component of breast milk is long chain fatty acid, especially DHA. DHA is crucial for the normal neurodevelopment and visual cortical development. And cow's milk contains only trace amount of DHA. Obviously, because the calves are not supposed to grow as brainy as humans, so they do not require that. That is why it is much less in cow's milk. And whatever little DHA that is present in cow's milk is poorly absorbed also. So practically, cow's milk is grossly deficient in DHA as required by the human beings. Now let's discuss the carbohydrate. Lactose is the principal carbohydrate present in human milk. In addition, there are some oligosaccharides, and this oligosaccharide is important because it acts as a prebiotic, that is the food for the microorganism. So, in presence of plenty of oligosaccharides, useful bacteria colonizes our intestine so that pathological or the dangerous bacteria do not get a chance to establish themselves there. As compared to lactose of less than 5% or 5 gram per 100 ml in case of cow's milk, human milk contains more than 7 gram per 100 ml of lactose, which means human milk is obviously sweeter than the cow's milk. And some important usefulness of lactose would be like it meets 40% of our baby's calorie requirement, enhances absorption of some micronutrients and minerals, and it acts as a osmotic laxative. And so the breastfed babies have got a softer stool as compared to cow's milk fed babies. And lactose acts as a prebiotic and supports microbiota, useful microbiota. Other than macronutrient profile in breast milk, the micronutrient profile in breast milk also differs significantly from that of cow's milk. Let us start with calcium and phosphorus. Calcium-phosphorus ratio ideal for absorption is 2:1, and the breast milk contains calcium and phosphorus in ratio 2:1. Cow's milk contains calcium-phosphorus ratio approximately 1:1, or rather 1.2:1. So that actually is not best for absorption. So human milk gives better calcium absorption. Naturally, the bone growth is better, or bone mineralization is better with Q. There are many reasons for increased risk of iron deficiency in cow's milk consumption. First of all, the cow's milk contains very low content of iron. Second, there is a chance of occult blood loss. That is because of the cow's milk protein allergy. And lastly, reduced absorption of iron, basically because of the calcium and casein that is present in the intestine in a cow's milk fed baby. It is true that breast milk also is a very poor source of iron. But what makes breast milk better is that 50% of available iron gets absorbed, as compared to only 10% of iron absorption from cow's milk. In addition to the risk of iron deficiency, bovine milk in early years of life causes problems of absorption of other minerals also. For example, zinc will bind to the casein, and so there can be a zinc deficiency in cow's milk fed babies. Malnourished children with diarrhea who are cow's milk fed are shown to be zinc deficient. Let's now see the imbalance of other micronutrients. On one hand, there is excess of micronutrients. On the other, for example, is calcium. On the other hand, there is decreased amount of some other micronutrients. Compared to human milk, bovine milk contains much more of calcium, much more of sodium, much more of chloride, much more of phosphorus, much more of magnesium, etc. So this increased presence of mineral causes high potential renal solute load. Actually, the potential renal solute load from cow's milk is calculated to be about 3 times higher as compared to human milk. In normal circumstances, it can be handled by a normal baby's normal kidneys. But when sick, it becomes a problem, because all these solutes need water to be excreted. So some extra water gets excreted to excrete this extra solute load. Suppose you develop diarrhea, or for example, you are not taking enough fluid, then what happens? you rapidly get dehydrated because the kidneys have to excrete obligatory some fluid to get rid of all these extra minerals, extra micronutrients. Renal concentrating ability of infants is limited, and that is why this problem. Under very rare circumstances, breastfeeding might not be possible or unsuitable or inadequate, which may warrant temporary interruption or cessation of breastfeeding. It then becomes important to wisely select a breast milk substitute which is appropriately modified for the age of the baby. It is not true that because breastfeeding is a natural phenomenon, each and every baby can be breastfed by proper counseling and support. No. Just think of normal delivery. It is a normal phenomenon. And with proper support and guidance and the normal delivery should happen to each and every mother. That is not happening. So many cesareans are happening. So common sense tells us that similarly, a breastfeeding failure also can occur occasionally. So that will need support and a breast milk substitute itself, because for brain growth you need many things that are present in unmodified cow's milk that is not modified or adapted for the infant is not suitable physiologically and to meet the nutritional needs of the baby. So it may result in nutritional imbalance. In addition, in our place, additional risk is adulteration of milk. To conclude, breast milk is the gold standard in infant nutrition without doubt. It is the first and the most ideal thing. In the very rare situation of insufficiency of breast milk, a suitably modified breast milk substitute must be considered because milk is very important for the brain growth at this age. Thank you.